Hey, so last time I had just started family medicine and I had just finished pediatrics and I was getting advised and all this stuff. So, on the advising front, I have about half of fourth year scheduled right now. I need to do the rest of it. But I have the tricky parts done, so that's good. I'm supposed to start surgery tomorrow. Um, yeah, the family medicine rotation is already over. That's kind of crazy. The whole thing just flew by. So my apologies for not posting. I really should have. But when you have more time, you get less efficient and you get less things done, including things like this. So, upshot is I'll probably be checking in a lot more during surgery than I did on family med because, it's not like I'm going to have time to go anywhere. For me to be here and I'm not going to be studying because I'm tired, I might as well record something. So, family med is done. I took the test on Friday. I actually really liked the rotation. It was a lot of fun. The patients were really nice and it was different than internal medicine in the sense that you knew you were going to see them again, so they were a lot more inclined to work with you, and you saw more healthy people, which is always fun. It's nice when somebody comes in and they're doing well, or somebody comes in and they've lost a whole bunch of weight and don't need their diabetes medicine anymore. That's fun. And then, you get the whole spectrum of people. You get really, really, really old people, and you get the babies, and you get the kids and the moms and the dads, and you get the whole family, hence family practice. And you get to do all kinds of different things, and the people there were really, really nice to me too, which was awesome. It's actually in a part of the city I really dislike, but the facility itself was nice enough, and the residents let me do things that technically I had no business doing. Like, I did a cervical biopsy by myself, which that was awesome. And I did a slide prep by myself and all this other stuff. It was a lot of fun. And I was thinking about, maybe I want to do family practice. There's a surprise. But then they kept coming back to this, both in the rotation structure and for the residents, there was this whole emphasis on the emotional aspects of medicine and how you have to process your emotional reactions, and it was really tiresome at the end. I'm there to work, and I don't see that changing about myself. I don't particularly want to get into how I'm dealing with stuff and start processing my reaction to this old lady that didn't want to take her medications and what have you. Like, I'll do that just fine when I get home. And here's the thing about med students, especially on rotation, is that we don't get to see each other very often. And so that when we do, that's all we can talk about is, oh my God, I had this patient that did such and such and such, and I had this patient that was really frustrating, and that's all we talk about, which is terrible, I'm sure, for people who aren't in the field. God, it must suck. Try and stop us from processing our emotions when we actually get to see each other. So, and then, I was thinking about having that as part of my residency, and basically they had this lunchtime lecture where they had us free write for 15 minutes and then talk about it with the group, and that's cool enough to do once, but they were talking about having that as part of their regular night float. So, like, night float, you arrive at the hospital and basically your job is to keep everybody alive until the team comes back in the morning to progress with their tests and what have you. Like, you're there all night anyway, doing all kinds of stuff. Like, they hardly sleep as it is, and then you want to add this 15-minute emotional response onto it? Are you kidding me? And then there's the whole aspect, like, nobody wants to be condescended to and disrespected and what have you. And to me, that's a little bit disrespectful, because try asking a surgeon to do that. No effing way. No way would they ever submit to that. And so, like, I don't know, the idea of having that touchy-feely, what I consider to be BS, as part of the practice for the rest of the residency is really not that cool, not that appealing to me. So I don't think I'll be doing family practice. In addition, just for the rotation, every week we had some kind of assignment, best practices and medical home and outside the clinic walls, and, thing after thing after thing that had very little to do with actual medicine, and I don't know, I wasn't feeling it. So the practice itself was awesome, but all that emotional baggage that comes along with it, no way am I doing it. So that's off the list too. It was a good experience though, and I'm glad I had it, and I would definitely consider it for maybe if I needed a career change in the future, I would consider it. So that was cool. And then I went and got the real advising session, so another one recently, and I don't know, things are starting to solidify. I need to go get advised by the emergency department of where I should do my away rotations, and if I can do some research during high interview season, because basically, like, if I'm going to do couples matching, my boyfriend is thinking about doing OB-GYN, which is kind of competitive. If I want to do emergency, then that means we need to apply to a lot of places, and I need to take every interview that I can get just on the off chance that's where we end up. So I'm thinking if I can do some kind of clinical research in the ER for those 6 really critical weeks, that'd be really awesome. Most of them should be local because we want to stay here, like we want to stay in state at the very least. So traveling shouldn't be too bad. Yeah, we're gonna try to stay here. So that's basically where I'm at this point. So tomorrow I start surgery. I have trauma surgery first. That's the one required surgery rotation amongst the 12 weeks of surgery. So I'm on call every 3 days for the next 3 weeks, which I'm really not looking forward to. But people say it's fun, and you know, it should be all right. Basically, I just have to get through 3 weeks. Like 3 weeks is nothing. And then after that, I have colorectal surgery for 3 weeks that everybody I know who's done it has really, really enjoyed, so that should be cool. And then no test after 6 weeks, so that's cool also. And then another 6 weeks of surgery. They'll give me new choices for like surgery electives, so I'll get to choose that. So basically, I think next week I'm going to try to post for the first week of trauma surge and talking more about the developments with my residency application and what have you, because I've decided basically I'm not going to study during ACS. I'm not even, or acute care services, trauma surge. I'm not going to study, so I'm going to try to finish scheduling 4th year the next 3 weeks, and you know, get all that stuff moving. So really enjoyed the questions I've been getting recently. There's been a lot of activity and it's been a lot of fun. So even though I wasn't posting, I was answering everybody's questions. You know, if you're interested, keep it coming. There has been a little bit of an issue with like med school advising stuff, and I'll be honest, guys, I don't know what the whole thing looks like right now, and so I'm assuming most of the people who are watching these either are curious about the medical profession, probably because they're going to start applying, and I'll do the best I can, but my standard advice is go track down the grad school counselor at your university. They'll be able to help you way more than I can. You know, hang in there. It gets easier. Okay, so I'll see you guys in a week.